Good afternoon, everyone. My name is Bo Chilton. I have the honor and privilege of serving as the CEO of Impact Community Action. On behalf of my 21 board member and 75 staff members, we want to welcome you to our 2016 Poverty Summit. Thank you. Impact Community Action has as its mission to reduce poverty by providing hope-inspiring help and real opportunities for self-sufficiency. We take that mission seriously because we realize that in order to solve issues of poverty, you can't do that with programs and services alone. It requires a collective effort. It requires community involvement, and it requires providing hope to those whose spirit has been broken when they walk through our doors. So we take that mission very seriously. We are one of 1,100 community action agencies across this nation and 50 here in the state of Ohio that serve all 88 counties. We serve over 25,000 customers a year. And one of the things that we take also very seriously is that when we need to be the voice of the voiceless, we will step into that role. However, we believe what is more powerful is to empower those who have traditionally been marginalized to speak for themselves. And so one of the unique features of our nonprofit board is that we are a tripartite board, having 1/3 private sector representatives, 1/3 public sector representatives, which include elected officials or their designees, and 1/3 of our board members on the governing board are low-income people themselves, people who have come through our programs and services or work for agencies that serve the poor. And so we want to make sure that we gather here today to talk about what is it that we as a community need to do. Certainly the issues of poverty are multi-layered and very complex. But what we want to also do is focus in on 3 areas today. We want to talk about safe and affordable housing. We want to talk about what is it that we need to do to engage our youth, particularly those who are out of school youth, ages 16 to 24. And we want to talk about how do we better serve our reentry population. And so we have a panel of experts here who are going to talk about that, but we also want this to be interactive. And so we will share with you a little bit of information about how you will log into a poll everywhere so that we want to ask some questions of our audience and have you respond immediately so that we can get real-time data. With that, I would like to bring up our City Council President for the City of Columbus, Ohio, the Honorable Zach Klein.
Good afternoon, how y'all doing? Thank you, Bo, and thank you to Impact and all the work that you're doing, and certainly to the panelists for taking the time this afternoon to talk about these really important issues. I'm Zach Klein, I'm the president of Columbus City Council, and I think it's wonderful that we're focusing in on safe and affordable housing, on reentry, and then youth opportunity, because there are so many different buckets of problems that address and lead directly to issues of poverty and underscore poverty issues. But it's probably those 3, and I think mainly, and something I'm a firm believer in and have talked about in the past year ever since I saw a study about the direct impacts on affordable housing. I think it's affordable housing that may be the linchpin to addressing a lot of society's problems, and I'm sure that makes someone like Amy Claiborne happy to hear, who's an affordable housing advocate. But when you look at outcomes for education, when you look at outcomes for health, for safe neighborhoods, for economic upward mobility, it all comes back to whether someone has a dignified, safe place to lay their head at night. And if you are a child in particular, then it directly affects the upward economic mobility that someone has as it relates to economic opportunities in the 3rd bucket, which is youth and young adult engagement. And then of course, if you're always behind the 8 ball because the cycle of poverty breeds the cycle of incarceration, then certainly reentry issues are so important. So we have a tremendous opportunity as a community to have our elected officials like myself, to have community leaders like you and those like Senator Tavares, help play quarterback on a lot of those issues to directly affect and make a difference in our city, because everyone deserves an equal opportunity and a fair shake. And I'm a firm believer that, especially as the president of Columbus City Council, that we have a role to play to make sure that starting line for the race of the American dream is an equal starting line for everyone. And right now it's a staggered start. So how can we, through policy conversations like this and policy implementation and funding, start nudging those lines closer and closer together so that everyone can have a fair shake? So I appreciate the opportunity to speak. I'm certainly grateful for the opportunity and the work that you're doing and the panelists are doing to move the ball forward. And I feel confident with the brain trust in this room in conjunction with Mayor Ginther and my colleagues on council that we can move the ball forward. We can make a difference in supplying the dearth of affordable housing that we have in Franklin County, how we can spearhead reentry issues to pull individuals out of the cycle of incarceration and the cycle of poverty, and then certainly identifying upward economic mobility for children, and particularly kids that are not, do not have education or lack the opportunity to get the education, how we can get them headed in the right direction. So at this time, I'd like to bring up Ken Wright, who is going to lead us in the conversation. Thanks, Ken. Thank you so much.
On a day much like today, in a town quite similar to ours, a gathering of concerned citizens laid the foundation for a public policy agenda that would clear the path to self-sufficiency for many people living in poverty. In the spirit of collective impact, these citizens tackled many pressing issues, including the need for safe, affordable housing, the realities of those re-entering the community after having paid their debts to society, engaging our youth and young adults so they may escape or never succumb to the perils of poverty. And they addressed many other barriers to self-sufficiency. Now, we're told there were skeptics and naysayers in the room, but we know with certainty that in that group were visionaries, stewards, and soldiers who believed that good didn't mean great, that great didn't mean progress, and that progress didn't mean to ease off the throttle. Instead, this group built momentum and caused a ripple effect. Like that tiny ripple referenced by Senator Robert F. Kennedy so many years ago, this group's single ripple crossed others from what seemed to be a million different centers of energy and daring. And those ripples built a current, which swept down the mightiest walls of oppression and resistance. And that's how the war on poverty was won. Now, this story has yet to unfold, but each of us here today has the power to write that first chapter. Good afternoon. I'm Kenneth Wright, the Director of Community Outreach and Engagement for Impact Community Action. And it is my honor and my privilege to welcome you to this Poverty Summit, the people, the politics, and the promise. We are the people, and through our collective impact, we can influence the politics that govern our city, our state, our nation, and our world. The promise, as we see it, is forged by the work we do here today and the actions we take tomorrow. This is your forum. Embrace it. Lean forward and engage. Speak your mind, ask your questions, offer your solutions, pledge your support, but most importantly, roll up your sleeves. As we embark on this journey today, we thank the Columbus Department of Public Health for providing its facilities. Likewise, we thank Columbus Television, CTV, for broadcasting this event to widen our ripple. And we thank our friends at Community Research Partners for crafting the poll questions that you will answer today. And we thank them for analyzing that data that we will put in a report that we will issue back to the community. With that in mind, we will be conducting 2 brief polling sessions this afternoon. We have traditional questionnaires, and for the adventurous, we have text polling capability. Now, for those of you that would like to participate in the text polling, please pull out your cell phones and text the message Impact CA to the number 22333. Again, you're texting Impact CA and not just Impact. You should receive a message that says you've joined Kenneth L. Wright's session, Impact CA. Hopefully everyone's ready. So as I close my remarks, it gives me great pleasure to introduce our moderator for this afternoon. Yvonne C. Freeman is no stranger to Columbus. She is a respected advocate of social justice, equity, and fairness for all people. As the immediate former executive director of the Human Service Chamber of Franklin County, Yvonne brings a wealth of expertise in leading diverse collections of stakeholders to sustainability, greater public policy visibility, and leadership. Currently, Yvonne is the new project manager for the Ohio Urban Resource Systems, which is a statewide network of community action agencies in Ohio that work tirelessly to break the poverty cycle in our great state. Ladies and gentlemen, please welcome Yvonne Freeman.
Good afternoon. Well, you can do better than that. I drove all the way down here from the city of the 2016 National Basketball Champions, Cleveland, Ohio. That would never get old in Cleveland, just so you all know that never gets old. Thank you again for having me. Thank you to the Impact staff for inviting me to join you for this very audacious conversation this afternoon. As Kenneth mentioned before, I hope you will take full advantage of being able to participate and engage in this discussion, because it's more than a conversation. We see it, we live it every day. It's about action. And so Impact, its staff and its board has given us an opportunity to not only look at it from a couple of different positions, but they're also giving us a chance to provide support for solutions. So with that in mind, before we get started, we really like to, because this is a communal opportunity, we really like to acknowledge the elected officials and representatives in the room. So can we have all of our elected officials and representatives please stand, be recognized? Excellent, thank you. Join me in thanking them. We thank you for being here this afternoon, and we value and welcome your input as well. So I have the great honor of introducing members, these brilliant, brilliant people you see before me as expert panelists. And so the folks are going to have an opportunity to talk to you a little bit about, as Bo mentioned earlier, housing, affordable housing, youth engagement, and reentry population. I would first like to introduce you to Amy D. Claiborne. Amy has a lifelong commitment and passion for advocating and improving the community in which she lives. From 2000 to 2015, as president and CEO of Homeport, Ms. Claiborne led all aspects in this large, multifaceted nonprofit organization that provides service and ranch rental housing, revitalizes neighborhoods, and helps people to remain successful homeowners. Please join me in welcoming Amy Claiborne. Senator Charlita B. Tavares, Democrat from Columbus, Ohio, was reelected and sworn in on January 5, 2015 as the state senator for the 15th District and assistant Democratic leader in the Ohio Senate. A committed public servant, she has served since 2011 as the state senator, which includes Bexley and parts of Grandview Heights, as well as the historic neighborhoods of the city of Columbus. She currently serves as the Senate ranking member on both the Ways and Means and Health and Human Services Committee. Senator Tavares. Kirsten Palmore is the coordinator of the Franklin County Reentry Coalition and the president of the Ohio Association of Local Reentry Coalition. She works out of the Franklin County Office of Homeland Security and Justice Programs, and an agency operated under the county commissioners. Let's please show our love for Ms. Palmore. Aramis Sudanada is the statewide coordinating director of the People's Justice. People's Justice Project is a statewide organization that organizes low-income people and people of color to lead the fight against mass incarceration. Through civic engagement, community organizing, and direct action, the People's Justice Project registered 5,000 new voters in Franklin County. Great work. Welcome, Aramis. Dr. Thomas K. Gregoire was appointed the Dean of the College of Social Work in 2010. He holds the BS, MSW, and PhD degree from institutions of higher learning in Kansas. Before becoming the dean in 2010, Dr. Gregoire served as the acting dean, interim dean, for 1 year after having served as the associate dean in the college from 2003 to 2009. Under his leadership and his development officers' efficiency, the college garnered financial support from generous donors totaling several $millions in recent years. Welcome, Dr. Gregoire. And then to add to this panel, we have some more beauty and brains at the end. Ms. Elizabeth Martinez is the president and chief executive officer of Big Brother Big Sisters of Central Ohio, one of the largest Big Brothers Big Sisters agencies in the country. As former vice president of programs for Big Brothers Big Sisters, Elizabeth participated along with leaders from 12 other agencies to develop Big Brothers Big Sisters of America's Hispanic Mentoring Initiative, which now has evolved into the model used by agencies throughout the country. Thank you and welcome, Ms. Martinez. At this time, I invite our panelists to take 5 minutes and provide opening remarks and introductions to the issues that are salient to them. Amy?
Thank you so much for having this very important program today. I'm very honored to be here and with all of my esteemed colleagues on this panel. You heard the news yesterday. There's decreasing poverty, and that news is welcome in our community. But a rising tide is not rising all boats. The opportunity gap is growing, and it's due to higher rents and the effect of where you live. Your zip code matters more than anything else in your life, and inequality is growing. And that's why my topic is the case for the right to housing. Do you have the clicker? Oh, good. So why housing matters? City Council President Zach Klein says it all. It's the linchpin. It underlies every issue that you'll hear about today and every issue facing our community that you're not going to hear about today, from health care and education to access to food. Housing affects everything. And when you pay too much for your housing, and you'll hear more about that, you don't have enough money to spend on food and transportation, medical care, child care, etc. The neighborhood and house in which you live, in which you grow up, is a major determinant in economic success as an adult. And at the end, when I talk about solutions, we'll come back to that. And living in unhealthy homes, we don't think about that, but everyone doesn't have a healthy home to live in. And unsafe neighborhoods affects physical and mental health. And that's why where you live underlies your health issues. And what we're doing as a community is treating health. We're medicating people when really what they need is a prescription for affordable housing. There's currently no right to safe, decent, affordable housing. There's no laws that ban discrimination based on your source of income. So landlords don't have to take a Section 8 certificate if they don't want to. That's a choice. We have on the books, there's due process laws for evictions, but they're not always followed. And here in Franklin County, we have the highest rate of evictions than any county in the state of Ohio. There are some rights, such as housing codes, that are not uniformly enforced. And we have many people in our community living in houses with paint that's peeling and other unhealthy aspects. And then there are programs like Section 8 and tax credits, the low-income housing tax credit program. They're not sufficiently funded. In our community, and actually across the country, only about a quarter of those people eligible for Section 8 housing have access, which means that people are paying more than a third of their income for housing. So the issues. 2008, the federal government provided about $171 billion that benefited homeowners. That's the interest deduction, other types of benefits and deductions from when you own a home. And most of that benefit goes to upper income people, people over $100,000 a year in their income. In contrast, if we had $22 billion more a year, there could be a universal housing voucher. Because as we address the issue of affordable housing, part of the issue is we need more housing. But part of it is people's income. You can work a full-time job and you don't have enough money to afford a safe, decent home in a safe, decent neighborhood. And so we could talk about a minimum wage, but that is not a living wage. And a living wage is where you could pay for your housing, your food, your health care, your transportation, and still lead a dignified life. In Franklin County, we had 19,000 evictions. And evictions impact families and people of color at a much higher rate. If you live with kids, your chance of eviction increases by 33%. These are issues of justice, of equality that we have to address as our community. Other issues, lead-in housing. Recently, the city of Toledo passed an ordinance requiring that there be inspections of single-family homes. I think it might be 1 to 4 family homes, because of the impact of lead on children. And we know that families don't always know that their children are experiencing the impact of lead poisoning. And although it's required to be tested, not all children are being tested on a regular basis. And so our children are becoming the lead testers. Income segregation. Columbus is ranked as the second most economically segregated metro area of the country. And what that means is, because we're so income segregated, it's very hard to move up the ladder of income mobility. And Franklin County, it's harder to do that than in other places in the country. Research shows when lower income families are dispersed in mixed income neighborhoods, families thrive. It's better for them academically and better for the children's welfare and for the adults' jobs. So, what do? We need to be part of the ripple of change and make a tsunami of change. We need lots of change in our community. Make our voices heard. Be an advocate for the right to housing. That's for housing for everybody, for teens, for people, young adults, for people who are re-entry citizens in our community, for seniors, and for families. Increase access to housing subsidies. As I said earlier, not everybody has access to what they need to afford a home. And ensure healthy housing for everyone. The 3 strategies: we need people to be able to live in revitalized neighborhoods where they have access to safe, decent, affordable homes. We need people to be able to move to neighborhoods of opportunity. Those are issues of inclusion. And we need laws and other tools to sustain housing when neighborhoods are revitalized. Because what happens is we revitalize neighborhoods, people of lower incomes are pushed out, and that's not right. We need laws and policies and obviously funding to make a difference.
Really great opening remarks, Amy. We appreciate the housing advocacy and learning a little bit more about evictions and some of the issues, the core issues with housing insecurity in Franklin County. Thank you for sharing. Thank you. We're going to remain in order. Senator Tavares.
Thank you very much, Yvonne, and thank you to Impact Community Action, first of all, for all of the action that you have taken on behalf of the residents of Columbus and Franklin County, because the word action speaks loudly to what we need to do for not just housing, but all of the issues that are on today's agenda. I want to open up with just a bit about community action and its focus. Bo Chilton talked about the war on poverty and certainly the start of community action, but one of the focuses was on poverty. And it wasn't specifically on housing, it was more or less on the income that people were making. But the income enables individuals to be able to afford their basic needs: food, clothing, shelter, health care, and a job. If you don't have the basics met, you're not going to be able to sustain yourself, and if you have a family, your family. I know we're going to talk about minimum wage a little bit later, and I know you have some information from Impact. But what I do know is here with an $8.10 minimum wage, it is approximately $1,296 a month that an individual makes. And if the average rent for a 2-bedroom apartment, a mom generally with 2 children, it's about $751. That's 57+% of their income. And so the rest has to be divvied up for utilities and food and health care and school supplies and clothing, and there just isn't enough. As the former housing chair of Columbus City Council, one of the issues that I was really attempting to work on before I left was to develop a community land trust, because we need to make sure that we have affordable housing in perpetuity, not just affordable housing today and then as a community is gentrified, and many of our Central City neighborhoods in Columbus, our historic neighborhoods in Columbus, are being gentrified. Elderly, fixed-income adults, and those on any kind of subsidy, those who have little resources, are being pushed out as the price of the home goes up or the apartment complex goes up or the property taxes go up as the rents go up and the valuation of the property goes up. So lower income people are being pushed out. Some of our policies, and one of the policies that I'm a little troubled by is federal policy, housing policy, the U.S. Department of Housing and Urban Development's policy around the vouchers. It sounds like a good idea, and certainly we should have never concentrated poverty in large complexes, because that was unhealthy also. But when you spread individuals who have little resources throughout Franklin County in this case, and they have no other resources or supports, there isn't transportation to and from jobs, there aren't jobs in those communities for the residents, individuals have to take their children to school or to childcare, and they don't have the resources to get them there, there aren't the social supports, then we're leaving individuals and families to fend for themselves. So we've got to take a look at the whole housing policy from the federal and state level down to the local level. And one of the things that I believe we need to do to address the whole continuum of housing needs is not only to have a community land trust so we can have mixed income neighborhoods and housing in perpetuity for individuals who are marginally incomed, but we should also index some of our subsidized and public housing. Because if somebody goes into, we have here in Franklin County what's known as Rebuilding Lives, individuals who were formerly homeless, who we've developed some very nice opportunities for housing, 1-bedroom housing units, to move individuals in. As their income goes up, there is nothing to move them to the next iteration of housing to meet their needs, but also to open up a spot for somebody else who needs a housing unit at the very lowest end of the scale. So we've got to really take a look at our policies, because we will never build enough affordable housing units for those at the very lowest end of the economic scale. And we've got to be forward-thinking in how we develop public policy around housing at the federal, state, and local level. And then I guess I would just conclude with one of the mantras out of the War on Poverty, which created impact, community action, and community action all across the United States and many of our other programs. In my other hat, I serve as the executive of a federally qualified health system that was also created out of the War on Poverty. And the mantra of all of those programs was, nothing about us without us. And it gets to the advocacy that we have to be stronger as advocates and make sure that the voice of the people who need housing, public housing, are at the table. As we spread individuals who used to be in public housing into communities across Franklin County, their voice is also being lost, because we no longer have housing councils at project-based Section 8 housing units. So we're not getting the voice of those who know best what they need and what they want.
Thank you, Senator Tavares, for not only reminding us, but introducing to some of us that public policy and legislation is equally important to this fight. Now we will hear remarks from Kristen, please. Yes.
I want to thank Impact for including this critically important topic of reentry in the discussion of poverty. Reentry affects every community in the nation. Reentry is not a new concept. As long as there have been jails and there have been prisons, there have been people who are reentering their communities. Today, our philosophy and our approaches to the issues that individuals experience as they transition back into the community from incarceration are new to the United States. The US spends $74 billion, with a B, billion dollars in corrections to jail, imprison, supervise more than 6.8 million Americans, which equates to about 1 in 36 adults. A study by the Urban Institute found that 30% of Americans have been arrested at least once in their lifetime. So given the sheer volume of the number of individuals who are incarcerated or involved in the criminal justice system, it is highly probable that someone you know or love has or is incarcerated. The perception of the general public is that individuals who are incarcerated are those people. In reality, these individuals are our neighbors, our friends, sons, daughters, mothers, fathers, and spouses. In Ohio, 1 in 6 adults are incarcerated. The number of people going to prison has increased more than 400% over the past 35 years, with women being the fastest growing population of those incarcerated. Of the 6.8 million Americans incarcerated across this nation, more than 50% of all incarcerated individuals suffer from mental illness and co-occurring substance abuse. Our county jails have become the de facto mental health hospitals and the crisis centers of last resort. Currently, Ohio is facing a heroin epidemic. Ohio has experienced a 277% increase in heroin addiction. And in 2015, 2,744 people died of drug overdoses. Columbus has 5 to 7 overdoses each day. So the Federal Center of Disease Control and Prevention reported in 2014 that 28,000 people died of overdoses nationwide. One estimate is that nearly 2 million people are addicted to heroin and opiates. This crisis has spurred a shift in public policy and sentencing in Ohio from the emphasis of punishment over treatment. It is known that treatment is twice as effective in the community and 1/3 the cost as opposed to treating individuals in jail or prison. So nationally, more than 95% of all incarcerated individuals, or more than 650,000 people each year, return to their communities. Ohio Prison releases approximately 1,600 individuals to Franklin County each year. The Franklin County Jail releases more than 30,000 individuals back into their community each year. A significant portion of those 650,000 inmates released each year contribute to the 1.5 million households in the US that are surviving on less than $2 a day. So when individuals are released from state prison, they leave with a gate pay of $79, unless they've worked. When individuals are released from jail, they leave with whatever funds are remaining on their commissary books, which is usually nominal or nothing at all, because 80% of individuals in jail are indigent. Some counties in Ohio have implemented a pay-to-stay policy where the costs range from $85 to $255 per day. Many individuals who leave jail leave with a large and looming criminal justice debt. So, a sustainable living wage and safe, stable, and affordable housing are significant challenges for those returning home from incarceration. It is estimated that 87% of all inmates are unemployed at the time of release, and 60 to 75 remain unemployed 1 year after release. So in conclusion, when individuals are released from incarceration, the communities to which they return have a vested interest in assisting their residents in reuniting with their family and obtaining valuable supportive service for stable and productive lives. Thank you.
Moving along that track, we'd like to hear from Aramis.
Thank you. First off, I want to say thank you to Impact and Brother Bo and Sister Carmen for having the People's Justice Project here to discuss these developments and these issues. However, indeed, I was tasked to discuss reentry and absurdity of mass incarceration. However, considering the recent developments in Franklin County, I would be remiss to not mention the assassination of 13-year-old Tyree King. Reports are telling us that he was shot down by Columbus police last night after a robbery. He was brandishing a BB gun similar to those of Tamir Rice and John Crawford, who were shot down in Beaver Creek, Ohio. And the police decided to murder this child instead of de-escalating the situation. On Monday, June 6th, 23-year-old black man was gunned down just 1 block away from Lyndon McKinley High School. Henry Green was killed by plainclothes officers whom, according to witnesses, had the surviving victim, Kristen Rutledge, did not identify themselves, nor did they give time for him to respond. Rutledge said Green owned a handgun but did not have it when plainclothes officers pulled up. Franklin County has adopted overly aggressive policing and prosecution strategies that are entangling far too many Black and Latino men and women in the criminal justice system, while doing little to make our communities safer. The city and the county are failing to follow best practices by reducing incarceration and the murders of Black people and Latinx being murdered. Between 1985 and 2014, the per capita jail population in Franklin County increased by 65%. The number of women incarcerated tripled. Blacks in Franklin County are 3.8 times more likely to be in jail than whites. 65% of the inmates in behind bars in Franklin County in 2014 had not been convicted of any crime. They were just being held for pretrial. Many people are spending long periods of time in jail in Franklin County before having their charges dismissed or being found innocent. Nearly 40% of people who had their charges dismissed or were found innocent spent more than a week in jail, or 30% more than 30 days behind bars. Franklin County District Attorney Ron O'Brien and Police Chief Kimberly Jacobs are responsible for keeping our community safe and the well-being of all the people in the Franklin County. But they have pursued policies and cycled a large number of black men and women and Latinx women and men through the criminal justice system and effectively criminalizing whole communities and frankly murdering people. Thus, the PJP response will be swift and strategic because black lives will only matter once we have black power. We will continue to struggle for the liberation of all people, and we're doing a direct action on Monday. If you want more information, please contact me via Facebook or via text. I'll be here for a little bit after we get this discussion. Thank you, all power to the people.
Very powerful opening, Brother Aramis. Thank you for sharing that, and thank you for reminding us that it's more than just mass incarceration, but we need to also look at police and community relations. Now we'd like to hear from Dr. Gregoire.
Thank you. I want to thank Impact, Bo and Anita, and respect greatly the work that you do, and I appreciate the opportunity to be here with a lot of experts, and I'm here too. One of the things that I value about this is there are a lot of contributors to poverty, and often we're in this zero-sum conversation, competing against each other for resources. We need something for children, but what about housing, and what about mass incarcerations? I think it's correct that we have in the United States 5% of the world's population and 25% of the world's prisoners. So there are really significant problems here, and there's not enough resources, so we compete against each other when we should be working together. So I appreciate that we're all up here together. Conversations on poverty that seek to promote actual change must not be limited to conversations about poor people, their characteristics, or their responsibility for their circumstances. There are fundamental structural issues in our economy that maintain and for the past 30 years have accelerated poverty and inequality in our country. We're among the wealthiest countries in the world, and we have the highest rate of poverty among developed countries. That's weird, but it's also true. How could it be that we have more money than anybody else in the world and one of the highest rate of poverty among all developed countries? It's not a simple solution, but one of the bottom lines is we're not creating enough jobs that pay and provide benefits at the level required to avoid poverty. In our current economy, if everybody that wanted a job had a job, we would still have a significant issue on poverty because, as we heard, we didn't hear this literally, but 1/3 of all jobs that we create these days pay minimum wage. We also in this country have a significantly smaller safety net than most developed countries and a general lack of child care, affordable housing, and access to health care. We tend to want to solve a lot of our social problems by locking people up, as we've heard already. And my background is actually in the addictions, and we haven't had a behavioral problem that we've solved by making a rule against it and locking people up when they violate it. And it's much cheaper, as we've heard already, to treat people. I think somebody mentioned a bit ago, or perhaps it was Bo, this notion that it's easy for some of us with privilege to step back and think that this is somehow somebody else's problem. But 40% of Americans will spend at least 1 year below the poverty line between the ages of 25 and 60. And if you never find yourself there, you still pay for it. How much of my tax dollars is going to locking people up? How many of my tax dollars is going to health care for people that haven't been provided for? We often engage poverty as an individual problem, and one of the things I appreciate from Senator Tavares, but also from Bo and Impact in general, is this call to advocacy. We're not going to solve poverty by focusing on individuals, and the evidence seems to be really clear that these nature-nurture models of poverty are gross oversimplifications. In the spirit of gross oversimplifications, I want to use an analogy, however, the poverty scholar Mark Rank uses that really characterizes how we think about poverty in our country. It's like that game Musical Chairs, where there's not enough chairs, and the fastest people, and maybe the cheaters, when I was a kid, but the fastest people get a chair. So in our poverty environment, that means that people with skills lose out. So a lot of our investment in fighting poverty, as it should be, is on skills and on skills training, and Impact does a wonderful job at that. But in this poverty game, as in Musical Chairs, there are not enough chairs. So we're paying too much attention to just individual explanation of poverty, and I just want to encourage the continued advocacy in looking at structural issues. Briefly about kids, because we have a better expert down here, I think, than I am on that. But it's appropriate that we're in the Columbus Public Health for this conversation, because poverty is, among many things, is also a public health problem and a public health crisis. We are learning that a child's ability to learn, grow, and thrive over their lifespan is heavily influenced by the experience of the first 5 years of their lives. Adverse childhood experiences such as poverty and its consequences, food insecurity, family dissolution, homelessness, frequent moves, violent neighborhoods, losing a family member and a supporter to prison or other incarceration, unsafe schools, all those things we know about as consequences of poverty. They have been shown to impact not just how somebody performs later in life, although there's a significant impact, they reduce lifespan. Sadly, the first 5 years, and maybe just the first 3 years of our life, are highly predicted by what happens. Our entire life is predicted by that, even chronic health problems. We often think about things like genetics and arguments of nature, but we know that ultimately genes are slaves to the environment. And there's research in a field called epigenetics that shows that the environment in which you live in which you're raised in is going to have a significant impact, even how your genes are expressed. So all of this is, to me, a strong argument to invest significantly in early childhood development. Yet in this country, we rank in 32nd, I think, worldwide in our public investments in early childhood development. But you could argue, giving all of this, that even working with adolescents is too late a start. Many of our interventions today focus on deficits as well, too. Let's fix some problems. But I think one of the things that should be clear to all of us, based on what we're hearing from folks up here, is that problem solving has really failed as a response to poverty. We need something that transcends that. And one of the ways to focus on that is to start building strengths of people as well as focusing on deficits. One of the things we teach, we have a whole curriculum on positive youth development and engagement. How do you build protective things around kids as well? We know the literature shows us really clearly that school and community engagement for parents and children, mentors, as we'll hear, I imagine in just a minute, from big brothers and big sisters, are highly predictive of overcoming many of the adverse experiences. The same two people could live in the very same situation, and if we build positive strengths and protective factors around people, they're going to survive those experiences better. So I think I will stop there, and my encouragement is just to remind us all that we can't have incremental. It's not a little more money, it's not a little more this. We need a conversation that totally transcends problem solving if we're going to get anywhere. Thank you.
A great way to segue in how we break down silos, particularly for our young people. And so we want to round off the opening remarks with hearing from Elizabeth Martinez around youth engagement.
So I also want to echo the thanks that my colleagues have extended to Impact, to Bo and his dynamic team for engaging all of us here in the conversation today. Wanted to start off sharing that there's an African tribe known as the Maasai tribe, that typically when they engage each other, and typically it's the warriors in the Maasai tribe, that when they greet each other, often the question that they pose to each other is, how are the children? It's to give an indication in terms of if the children are doing well, then we know the rest of the community is probably doing well. And I would venture to say that if we pose that question to the group here today, that we would have some concerns about how our children are doing in the community. You saw the handouts as you walked in. We know that we have over 280,000 kids in our community that are living in poverty. We've heard some of the colleagues talk about in terms of the adults who are incarcerated. We know the Annie Casey Foundation has indicated to us that 10% of the children in the Ohio population are impacted by their parents being incarcerated. And we know that what those implications are for kids. Those kids are 30% likely to experience mental health issues themselves. We have kids that at very young ages are dealing with stress, anxiety, and depression in many cases. And so, we have 22,000 kids in Franklin County that are chronically absent, meaning that they have a month or more of school days that they have missed per year. knowing that a lot of those challenges that kids are dealing with really sets them back in terms of being able to be successful in the academic arena. I wanted to specifically speak in terms of the state of the movement as it relates to mentoring and share a couple of details. Over the last couple of decades, there's been growth of youth being engaged between the ages of 8 and 18 with one or more risk factors present in their lives that found themselves to structured mentoring relationships. And while that's good news to share, unfortunately what we know is that there's also a big mentoring gap that remains. So there was a nationally representative survey that asked young people between the ages of 16 and 24, primarily the population that we're speaking about today, whether they had a mentor outside of a family member, so beyond Uncle Joe or an aunt close to the family. And 1 in 3 of those youth said that they grew up without one person that they could turn to in times of struggle and triumph outside of the home growing up. And I just want that to sit with us here in this group to say 1 in 3 of those youth had to say that they didn't have someone outside of their immediate family to turn to. And that was in times of struggle, but also in triumph. So 1 in 3, that's the remaining gap that we have in mentoring here in America. And more we're learning about the inequalities and inequity in our communities that many of us here in this room are seeing as we're in the trenches every day. We see the work of individuals, for example, Robert Putnam's book, Our Kids, the American Dream in Crisis, and how he has an entire chapter that is focused on mentoring as one of the solutions he points to for helping to close that inequality gap. But most importantly, I think for us to listen to is the voice of our young people, the work that America's Promise has done with Don't Call Us Dropouts and Don't Quit on Me. Young people are saying, and I quote, "I didn't make a conscious decision to disconnect from the paths that would lead me to success in life. It was the adults that quit on me, and that's why I became disconnected." And that's a reality. I think the youth voices are getting louder in the community about the relationship poverty that exists, and I think even more importantly, the poverty of positive adult relationships that our kids need to be able to thrive in the community. We know that the Franklin County Youth Needs Assessment was just here recently released, and I know that mentoring and other areas of support was highlighted there, and I see Council Member Harding here in his work with MBK, also hearing the youth voice, where they said, we need more people to surround us. We need a web of support, and I think that that's incredibly important. It's imperative in our work as we give consideration to moving the needle in the educational space that we think about in terms of some of the challenges that our kids are dealing with on a day-to-day basis. What we know is that if kids are showing up on our grid of having challenges with behavior and attendance, and coursework, that there's some underlying issues that we need to address. But most importantly, this issue about relationship poverty is something that we need to begin to really focus on in terms of leveraging that as a strategy to help move the needle in some other areas in the community. So I believe that if our goal as a community at large is shared prosperity, then we certainly have some gaps to fill in our community. I love the conversation about advocacy, because I think it's incredibly important as we share some of these dire statistics that we all share very, very consistently, that we also play a part in helping to change the narrative for kids in our community, from a conversation of deficiency to a conversation of our kids being assets in the community. And I think as we embark today in the launch of Hispanic Heritage Month, I'd be remiss if I didn't mention that in the year 2050, it's estimated that 1 in 3 children in this nation are going to be Latino, but we also heard about the statistics of overrepresentation of men of color in the incarceration system, and that's both African American and Latino. And so what we know is that we need to work ahead to make sure that we are really addressing these issues from all different angles.
Thank you. Please let's give all of our experts a hand. As you heard before, here's what we're walking away with today. 90,000 evictions in Franklin County. Housing as a linchpin to many of the cross-poverty issues. Gentrification leaves out not only low-income families, but our elder. The USA spends $74 billion on corrections. $74 billion on corrections. The prison system has become a de facto for mental health treatment. Police and community relations leave African Americans and people of color disproportionately incarcerated. We are the wealthiest country with the highest poverty rate. The dichotomy, the wealthiest country with the highest poverty rate. 280,000 children in Franklin County alone live in poverty. Elizabeth reminded us of the African tribe of saying, how are the children? How are our children? So if you don't participate in this conversation, if you don't provide the feedback that we can use to move forward to call to action, where will that leave our children? So the first question we'd like for you to respond to is, what sector do you represent? The public government sector? Are you a representative from the private business, nonprofit, not-for-profit, so an agency or religious affiliation, or a community like a neighborhood group or concerned citizens? Please, again, text your responses to IMPACT-CA 22333, or take out your paper and your pen and respond that way. Our second question, in just a few words, Kenneth, would you like for me to move on? In just a few words, how would you describe affordable housing? And you've heard our experts in the room. You heard President Klein talk a little bit about housing insecurity, affordable housing. How would you describe, in just a few short words, affordable housing? What does that look like to you? What does it look like for our children? What does it look like for our community and our neighborhoods? I hope you're taking a moment after you're done texting it and recording your responses to look at some of our responses. And so if it's difficult to obtain, or it's invisible, or if it's one-third of, when we think about one-third of housing income, they're spending one-third of their housing or less on income on housing. Imagine the state of this crisis when we're talking about how do we come together to help solve these issues in our community. Let's move on to number 3. What is your level of familiarity with the term toxic stress? How familiar are you with the term toxic stress? A, extremely familiar, B, moderately familiar, C, somewhat familiar, D, slightly familiar, or E, not familiar at all? Have you heard the term toxic stress? Do you know who it impacts? So many of us are very familiar with toxic stress. We understand the impact it causes to our community, to our young people, to opportunities for growth and development. Number 4, according to the Center on Developing Child at Harvard University, toxic stress occurs when a child experiences strong, frequent, and/or prolonged adversity, such as chronic neglect or exposure to violence with insufficient adult support to cope. Please rate this description reflects toxic stress as an issue among youth in Columbus. Now remember, Elizabeth shared with us that 22,000 of our children right here in Columbus, Ohio, have chronic absenteeism. Toxic stress is when children have strong, frequent, and/or prolonged adversity with little or no exposure or support from adults to help them cope. This is clearly a very serious problem for us with our young people. Number 5, Columbus area social enterprises, which are companies seeking profit and community benefit, have grown on the heels of employing restored citizens, offering them income and skill development as pathways out of poverty. In your opinion, in which ways can the community be effective in supporting and expanding the scale of these businesses. So I want you to think about it from expanded incentives to hire, like grants. How can communities be more supportive of expanding the scale of businesses for social enterprise ventures? Is it essential to our community? Is it a high priority, medium priority, low priority, and not even a priority at all? Excellent responses. Number 6, Columbus area social enterprises, again, companies seeking profit and community benefit, have grown again on the heels of employing restored citizens, offering them again income, skill development, and pathways out of poverty. What we'd like to know from you now is what ways do you think that this could be expanded that would involve skills and workforce development? So think about it from offering more opportunities to be involved in skills and workforce development. Do you think this should be essential to the work that we're doing with social enterprise ventures? High priority, medium priority, low priority, or not a priority at all? (53.4%). We find it very essential to our community. Keeping with that for number 7, keeping with the Columbus area social enterprises, now think of it in terms of expansion from a health and wellness development. So again, how essential do you believe it is for us to begin to expand these opportunities from a health and wellness perspective? And continue to think about health and wellness from a broader perspective, not only just physical health, but we're talking about mental health, behavioral health, we're talking about life expectancy, preventable care. So think about it from a kind of a broader community. Three more. You all are doing great. Let me see your phones. Put your phones in here and let's see how we'll, oh, y'all look good. Good job. We're very proud of you today. Thank you. So again, let's stay with the social enterprise conversation. Now think about the expansion for public support for government contracts to these enterprises. So again, these are opportunities for us to create pathways out of poverty for many folks. So if we want to support their scale, if we want to support their growth, think of it from a public support for government contracts to these enterprises. Again, how essential are the government contracts to their growth? And then the last thought regarding the social enterprise ventures. Now think of it from connecting social enterprise to financial and wellness professionals. So how do we expand with connecting social enterprise to financial and wellness professionals? It's not enough to just to have the expansion, but we want to make sure people are prepared, they're informed, they're educated, and it's sustainable. Excellent. So 2 more questions for this first polling. Number 10, in your opinion, please rank the greatest threat to the affordability and security of housing in Columbus. And we want you to rank it from 1 being the highest to 6 being the lowest. So gentrification of neighborhoods, segregation of neighborhoods, absentee landlords, emphasis on development of luxury apartments. Oh, I'm sorry, wait, pause. Oh, this one has to be done on paper, I apologize. So take out your salmon color paper, I apologize. I got so excited you all were doing such a great job. So please take out your salmon color paper and follow along for the last 2 questions, please. Again, in your opinion, please rank the greatest threat to the affordability and security of housing in Columbus. And again, please rank them from 1 being the highest to 6 being the lowest. Is it wages and subsidies not keeping pace with increasing rent? Lack of opportunities for home ownership? Emphasis on development of luxury apartments? Absentee landlords? Segregation of neighborhoods? Or gentrification of neighborhoods? Thank you for calling it out for me. And then lastly, reentry and restored citizens. Please rank the barriers to success for restored citizens. Restored citizens, for some of that may not be familiar with the term, are former offenders returning to their communities. So please rank the barriers in order that they should be addressed. And again, rank from 1 being the highest to 5 being the lowest. So do you see the biggest barriers for our returning citizens as job training skills? Is it adequate housing, educational attainment, mental health counseling, adequate transportation, or is it something else that we may be missing the mark? When you have completed your paper poll, please pass it to the end of the aisle, not the middle, to the other side. And one of our wonderful impact staff members will collect your paper polls. We have a few mics up here, and we'd like to invite you to participate in the open forum. So if you have some questions, maybe some more direct questions to some of our panelists, or some other questions, we'd like to ask you to come up or raise your hand, and we'd be happy to pass around the mic so that you can have your question heard. You want this one? Any questions? Again, all right.
All right. Good evening. Good day, everyone. So this is for all the panelists. The question is, what do each one of you do day to day in order to address the issue of poverty? So that would be examples of systems, projects, etc., that you have put in place or tried to enact. And are you seeing progress being made with those initiatives? And how are you finding new ways to ensure the initiatives are meeting the need to move people from poverty to equitable inclusiveness in the economy and housing, etc.?
It's a great question. I hope you guys can answer it today.
That was a good question, brother. Thank you. Quickly, I will give a quick synopsis of what has happened a couple of days ago. So I was in Oakland, California, with our national partners from All of Us Are None and other organizations that focus on returning citizens and folks who have convicted felonies. There were about like 1,000 people there from the incarcerated. And in California, they actually passed this bill called Prop 47. Now, if you're not familiar with Prop 47, what Prop 47 did, without going to a whole legal discussion, essentially took felony offenses and dropped it down to misdemeanors, and it went retroactively, so that meant that 40K walked out of prison, and those who were going through the judicial system with a felony dropped down to a misdemeanor and just walked home. Now, the interesting thing about that development, however, was one, it was run by a grassroots organization. It wasn't run by some some policy agenda. It was grassroots like PICO and other organizations. Two, is that once the people left and they saw how much money they saved inside of the release of all these inmates, they reallocated the funds into the communities that were directly affected by the removal of Black folks and our Latino brothers as well. So why that's important? Because what they did was actually put money in communities in which were trauma recovery centers, drug counseling, et cetera, all the things that we always talk about that we need, well, they did it. So to answer your question more precisely, so in Ohio, we are actually working with partners to actually do a bill similar to that. However, we're not California. We're not a local state. We don't have a population of brown and black and brown people that is overly, represented. You have majority white folks and some black folks and trickling of brown people. So we have to go a little step further to like do a constitutional amendment in Ohio, and we're going to do it in 18. It seems as though as we're planning, but that's our plan to do that. And as we build that political power, we have to organize our base and our people through the process. So that's what PJP is doing statewide, and that's how we think we should. We need to get people out of prison first. I mean, like look. Like when you go into these institutions and you see how many people are in there, like it blows your mind. And then you have these conversations about how folks are like, well, we gotta be tough on crime. I mean, how much tougher are you gonna be? Like you're removing people on purpose. You know what I mean? Like you are literally removing people on purpose and putting it with extensive time. And all that money is being pushed to the institution to make it run. So that's where I'm at with the development of asking the question of economics and all that stuff, because you won't have any economic power unless you have political power. And I have to run. I got to go to the office. But thank you for having me, Mr. Bowe. I'll see you soon. All proud of people. Thank you, brother.
All right, well, thank you, Brother Aramis. Be careful.
That the gentleman asked. I work on this issue every day. Certainly I've focused in on housing and health and human services issues, and for me, health has been a priority, a policy issue, and I don't believe you can be ready for a job or ready to learn if you're not healthy. And so I work on the public policy side, and then on the community side, I work with community members, whether it's individuals who are looking for a job and trying to assist them with a job and connecting them to those who can either hire them or prepare them for work. Because it's important that we not just work in our little sphere of influence, whether you're a public policy maker, whether you work in an organization, and then connecting organizations, because all of us are working in some way to touch the individuals in our community who are vulnerable in some way, whether they're children or whether they're seniors or in between. And if we work more as a collective, we can get more done. And I guess that's where I'm trying to connect our social services, our health, our reentry coalitions, and those who want to advocate for what needs to be done to improve the lives of the people within our community and, for me, within our state.
So just to speak specifically to the work that Big Brothers Big Sisters is doing here in our local community, we talked about addressing some of the issues of education. We know that one of the pathways out of poverty is education, so it's certainly a great priority within our organization to make sure that we're intentional about focusing on the issue of education within our platform and between both our community-based and school-based programs. So we do that by bringing in positive adults, as I talked about earlier, filling the gap of that relationship poverty in our community and helping to foster resilience and grit in our kids that we know that they already possess. It's just a matter of helping them bring that out. But I think beyond just, you can have all the grit and resilience in the world, but if you don't have access to opportunity, then it really is, falls on deaf ears. So part of our work has really been embedded as we're identifying barriers to success for kids in the educational arena. It's about us connecting with other partners in the community to help challenge some of those barriers that kids have. And this has really challenged the work of Big Brothers Big Sisters over the past couple of years. We've been very intentional about really thinking about how we become allies with parents in our programs and become true partners so that we can truly identify what those barriers are and help to eliminate those. And that has come by way of really taking this approach of wraparound services and beyond the mentoring experience. Once we've identified what those root causes are, addressing and tackling them with collaborators around the table.
So thank you for asking that question. I'm with Strategic Opportunities. It's a new consulting company, so I'm working on a number of areas. One is, how do we create mixed income communities throughout Central Ohio? So there's a number of different strategies that I'm working with others on, and understanding that it's not just housing, it's knitting together the right kind of services and supports and coaching so that families can thrive, whether they're in the central city or in suburban areas. But it's creating these new kind of opportunities for inclusion are so crucial for our future. The other is working with a coalition statewide to look for funding opportunities. How do we ultimately fund affordable housing and bring new resources, knowing that the federal government resources are limited? And so we need to look at that at the local level and at the state level. And so how do we work on that together? So we're doing that. And then the housing issue touches everything else. I'm working with many people in the community to just do what Impact's doing, and thank you to Impact for creating opportunities for awareness for these important issues. So many community leaders that I meet with really don't understand what people here see every day. And we have to work together so that community leaders in the both public and private sectors, the ones who are not as enlightened as folks here, understand the issues because they don't see it. And so when you don't see it, it doesn't exist, and that's not okay. And so we have to work together to ensure that people clearly understand the challenges facing so many people in our community so that all of us can thrive.
I think the short and the long answer of what I do on a daily basis is educate and talk and push the envelope to talk about fair and equal treatment for individuals who are coming out of incarceration. I talk to social service organizations. We talk about the impact of mental health and substance abuse on individuals who are coming out, and the fact that putting people in jail or prison because they have a substance abuse or addiction or mental health is not the proper place for them, and the jail and the prison are not the place for you to get treatment. I talk about the importance of social enterprises and giving back for how I can galvanize the public to understand the importance of social enterprise and how it is an opportunity for individuals who are coming out, who have skills, who just do not have the opportunity to get ahead. I work with ODRC, the Department of Rehabilitations, on issues talking about employing individuals who are coming out who have barriers. And we work on certificates of qualification and employment. I push the envelope about affordable housing and talking about and trying to let everybody who knows and who can hear that housing is health care. Proper housing, adequate housing is health care, and it transcends every aspect. If you can't get a house, then how do you go to work in the morning? If you have a mental health or a substance abuse issue, how do you stay safe? You have to stay away from familiar places, persons, and things, and how do you do that when you don't have housing? I push the envelope, and I'm talking to people in the federal government about the HUD's definition of homelessness. The fact that if you come out of incarceration, that you are not considered homeless. Now, the number of people who go incarceration, the address in which they go in is not necessarily the address that they come home to. And the fact that many of the people that we see walking around are homeless and have justice involvement. I educate people on what it means to be justice involved. It's not just a person who's been in jail, but there's a person who has been contacted by the justice system and the criminal justice system at each and every aspect of their life. So whether it be on probation or parole. And I educate people on the fact that a person's zip code is a social determinant as to whether or not they're going to have a contact with the criminal justice system. So we have to stop creating these pockets of poverty. So that is what I do on an everyday basis, and try to get more money for more social service and more programs in the jail and the prison.
Thank you. Dr. Gregoire?
That's a great question. I'm glad you brought it up. I'm going to give a two-part brief answer. And the first is professionally, I have 900 students in the College of Social Work, and these are people we're going to go out and send into the world to help do this work. So what do we do on a daily basis with our faculty and staff? We work hard to make those 900 students uncomfortable. I need them to think outside their privilege, think outside their own experience, so we work hard to have conversations that are uncomfortable, that need to be had. So we create safe but uncomfortable conversations. We train advocates. We're doing more on our campus than anybody else and holding conversations campus-wise around race and poverty and inequality. So we're pushing everybody's buttons a little bit because we think that's part of our job. But I want to answer personal too, because I think it's an encouragement to all of us to reflect on what are we doing personally around that. I volunteer, I give away a fair amount of my money, and everybody I engage, whether they're homeless or my university present, I try to engage them with kindness. I walk down High Street on campus and I see many homeless people, and I might not have money for them, but I have respect and kindness for them, so I make eye contact and I don't pretend that anybody I know is invisible. So that's what I'm doing.
Thank you. Thank you. So we want to keep the forum going, and we're going to get a couple more questions in. I'm going to ask my panelists, when you're speaking, to try to keep your comments 1 to 2. I've been trying to be very gracious with your passionate sales this afternoon, but now I'm going to have to be a little bit more of a bully and ask you to keep your responses brief.
For me,
Yes.
Okay. First, I want to commend Bo and your team here for this great conversation. I've heard a lot about housing, and I just wanted to encourage our panelists to think about two key areas as it relates to housing. One is when you look at the development of permanent supportive housing, which I've come out of that system, working in that system for 25 years. Many of those projects are developed at about $55,000, $65,000 per unit. If we start to look at some advocacy around a balanced strategy and put some of those resources into more flexible rent subsidies, we could serve a lot more people. So hopefully we can get some consideration to that type of advocacy. The other thing is, if you look at the continuum of care, Senator Marcy mentioned continuum of care, Columbus receives about $11 million in continuum care funding. Cincinnati gets about $19 million, Cleveland gets about $23 million. I think we should have some advocacy around that funding strategy as well. So it's not a if or it's more. That's what we need. So I just wanted to actually encourage there to be some discussion around those initiatives.
Thank you, Anthony. I think I saw a hand over here, and I'll get back to you, sir.
Thank you. Good afternoon. Thank you so much, Bo and the panel. I represent a very large agency here in Franklin County. We have about 197,000 individuals who are receiving food assistance, 250,000 individuals who receive Medicaid, 33,000 children who receive publicly funded child care dollars. But we're also a funder. And my question is simply this. Well, my statement and question. We fund a lot of programs, and we believe that we cannot program our way out of this. So we need collaboration with everyone in this room in assisting all those numbers that I just ran it off to each and every one of you. So as experts in your field, how do we begin to align everything that we talked about today? So that things that we do fund, they're not funded in silos, but they're funded in systems.
A quick stab at it. I think one of the ways we can do it, I have a bill, Senate Bill 30, which creates the Family Stability Commission in the state of Ohio, which will allow us to take a look at all of the policy programs that impact individuals and families, but most importantly, we're looking at the child. What is going to make that child thrive? How are our policies and programs negatively working against each other so that we can come together in what we're doing and come up with a plan to address, because we have federal policy, state policy, local policies in some cases that work at odds. And if you don't look at it holistically, you're never going to address it. It's in the House of Representatives. I saw my colleague Representative Boyce, who I believe is on the Community and Family Engagement Committee. Representative Craig is here. It's in the House of Representatives. It's already passed the Senate overwhelmingly. We need to get it passed before the end of the lame duck session.
I would just, most people that engage some kind of health system engage many different systems, and we're really siloed. We have our service. It's hard work to get what you need. The language changes, the locations change. I think we have to have a serious conversation about whether we've organized our services more around our needs as workers and less around the need of the people that need our services.
A lot of the reason for the different systems is the federal government. So make your voices heard with your elected congressional representatives and senators, that the agencies need to work together. And from the top, the programs need to say, if we're funding housing, fund the services at the same time, which we can't do, so that we're serving families together. And look at locally, you know, you've got, on the local level, you have the education funding over here, and you have city funding and policies over here. How are the systems working together with health, education, and housing, and all of the other issues, so that we're bringing the resource together holistically?
And that's a really good question. Not only how we working together as systems, but how are we working together as systems for families? So it's about families, but how often do we actually engage families? It's great that we can think through policies. It's great that we can find programs and services to offer, but if it's not hitting the mark, if it's not addressing the real need, you can't put anger management treatment on something that has to do with housing, or you can't expect young people, as we've talked before, to be successful in school when I don't have a vision, I haven't had a vision screening, or I haven't had a dental screening. So before we begin to kind of pull this fabric together, we have to think about how are we actually engaging families in the dialogue.
My name is Carlos Christian, president and founder of Starts Within Organization. And my question is, what we do is we work with individuals who are incarcerated, and we have been able to be effective with these guys and working with them while they are currently incarcerated instead of waiting until they come home. So I guess I would say that our biggest problem probably would have to be, I believe, is that working with the impoverished mind instead of just looking at poverty, but looking at the impoverished mind. Because a lot of times with incarceration, it's the incarcerated mind that keeps people incarcerated and leads people to commit crimes because they don't believe that it is nothing else out there for them. So I believe that programming to get inside of the individual so then they can understand that it's a new way to do things and it's a new mentality to be able to be successful. Until these people understand that they can do something else, guess what? There's no resources that's going to be able to help them. I know that because I was incarcerated for 10 years, and the worst incarceration that I faced was when I was 13 years old, and I felt like that I couldn't do anything but sell drugs. And when I got incarcerated inside a prison, and that's when I felt like that I can do something else, and then I needed the information. So now when we are talking about poverty, we got to start to think about, I believe, is getting the people the information about check cashing places. How, if we get them low level, if we get them low income housing, and then once they get the low income housing, are they going to stay in that low income housing? I have my grandmother, and then my aunt is all in low income housing. So it's just a mentality that continues to repeat itself, and it's low quality living. Everybody on this panel, I see that you are successful, right? And what's inside of you that makes you successful is your mentality, the information that you have been given because of the way that you've been developed. Some people have been developed to crash and burn. So I ask you, have you thought about like going into the projects and turning the projects into the suburbs by giving them the information that they need to start to go about things in a different manner?
Thank you. Thank you. Great question. Great question. I would agree. I think that's certainly a great question. One of the things that I wanted to address is that we've been focused on, again, our goal is to get upstream, right? We're trying to be preventative in nature. There are many occasions where we're providing direct intervention for kids that are dealing with crisis, but if we're really thinking about going upstream, our work has been focused in both school-based and community-based programs around the work of an individual by the name of Dr. Carol Dweck. Her work is specifically embedded in growth mindset, so really tackling the issue, Carlos, I believe you were just mentioning here, in terms of how do we really help kids think about in terms of they have the power, they have the capacity to really think differently than what they have been exposed to. So this dichotomy of the fixed mindset versus the growth mindset, and really leveraging our platform to introduce concepts that are different for kids, but that really equip them and give them the tools that they need to be successful.
I guess the only other comment I would have, and I thank you for the question, is that we have to have the people who are impacted most, going back to an earlier statement I made about nothing about us without us, but having the voice of the people who are impacted at the table. We cannot continue to develop programs and systems and policies without the advocacy, and that's why I'm so glad that Bo and Impact are really trying to develop advocates within the clients that they serve. We need more people advocating for themselves of what skills and talents they have and how we can assist them, rather than our deciding what's best and deciding how best to spend the resources. Allow people to make some decisions for themselves and talk about what works for them, as opposed to our always making those decisions for them.
My name is Ryan Owens, and I represent Woodforest National Bank. I'm here today. We deal a lot with Impact. We teach what we call financial literacy. To kind of touch a little bit off of what the gentleman was just speaking about, I hear a lot of people say education, education, education. If you give a person a ton of education, they can get a degree, they can be successful, but if they get that check and they don't know how to spend it, at the end of the day, we're putting them right back in a situation. People don't rob, steal, and do things like that until their back is against the wall and they've been told no, or they don't know how to come up with it. So one thing is how do we get into the schools, get to our youth when you ask how our kids are doing, and teach them financial literacy early, where it comes to credit, where it comes to even the value of a dollar. How do we get in there and kind of put that horse before the cart versus where we're at now to kind of prevent the poverty? Anybody can answer that.
I think being in the education business, you start where they are. So you go to their house, you talk to their parents first, and you just go where people are. I want to congratulate you on your path, and thank you for giving back and for the good work that you do. I want to make an observation. You noted that the panel is successful, and it's partially because we believe we could be successful, but my privilege didn't help, or didn't hurt. And the fact is that someone who has to work their way out of prison or out of poor housing or a huge economic hole, we heard Councilman Klein speak earlier about that starting line. We need to not forget that. Part of this conversation, if we're really going to transform things, is going to be about privilege. I might not have been in prison because I could afford a better lawyer than you could. You know, we need to not lose sight of the fact that we didn't start at the same place. And those are the difficult conversations we need to have in society. So it's important for people to lift themselves up, but we have to look at from where you got to start when you're lifting yourself up and not lose sight of that. So that's a system issue.
So I'd like to add that the programs are needed. I think some schools provide financial literacy training. The Boys and Girls Club includes it in their programs, and we should encourage all the after-school programs to include these kinds of issues. But it doesn't stop when kids are finished with public school. I've got adult children. They're in their 20s, and we still have these conversations. And it's a lifelong conversation with people as their situations change. And so how do we encourage the relationships and the mentoring that's needed, again, doesn't just end when, kids age out of foster care. I mean, you can include those kinds of issues. It doesn't end at 18 or 21. It's the supports to our friends and colleagues and people we don't know, and in how do we create relationships so that we've got the mentoring and the supports and the encouragement to keep learning so that people learn as they go.
Thank you, Amy. I'll take one more question before we go to our second part of our text polling.
Thank you, panelists, for your time, first and foremost. My name is Castle Green, and I am a second-year teacher at Early College Academy in downtown Columbus. My school services 16 to 21-year-olds who have had at least 2 years of high school experience that have faced academic or personal crises or traumas that have hindered their progression. And my population, for the most part, is mostly impoverished students who have had gaps in their learning over years. From elementary school to high school, when they got to the point where they were able to drop out, but they wanted a second chance. And part of our work beyond education is being a warehouse of resources. And it got me thinking, listening to all these questions and to your remarks, how can the traditional district setting, or even a traditional school setting, become that warehouse of resources for their students so that way their physiological needs are met to promote education?
Thank you.
I'm going to go quick so others can talk. The schools where most things happen, the schools could be a place where food becomes available, where healthcare becomes available. I know there's some conversations in this community around that. Instead of people having to go hither and yon finding what they need, it could all be at the schools. That could be the hub where all the helping and resources people need are.
I think to the extent where those programs that support those schools exist, it might be, the conversation was mentioned earlier in terms of alignment, to really figure out for those specific schools, identifying what are those emerging needs in that specific population and making sure that those individuals that are engaging with those schools are really helping to address and meet those needs.
Thank you all for participating in the question Q&A forum. Let's thank our panelists one more time. When you think about this afternoon and as you answer these questions, keep in mind that while we are very gracious in having our expert panelists join us this afternoon, we're all experts in the room. Everyone has some sort of expertise. Everyone has some sort of testimony or some sort of background that can help. So when we're talking about issues with Big Brother, Big Sister and mentoring, Senator Taveras is always inviting us as community representatives and leaders to come to the State House and have conversations and advocate with our state representatives. When we're thinking about re-entry, what are you doing? What are you doing as an individual? What are you doing in your capacity? What are you doing in your organization or your communities to help advance and move some of these things forward? It's not just for the folks with the mics. It's all of us. It's all of our responsibilities. So that's one of the reasons why Impact has taken the lead on not only inviting you to join the conversation, but be a part of the solution. It's not enough that we sat in this hot room today and you're texting and answering these questions. Let's do something about it. So keep that in mind when you're responding, and then when the call to action goes out, we need your participation. So let's look at the number, the first question for part 2 of our polling, and we're gonna look at affordable quality housing. Please rate your level of priority for the following policies and strategies to advance affordable, secure housing in Columbus. Inclusionary zoning, which is a certain percentage of new housing required to affordable housing. Please rate the level of priority. Is it essential? Is it high priority? Is it a medium priority, low, or not a priority? Again, if you just joining us, we would love to get your responses via text message at 22333, IMPACT-CA. And if you still have your yellow form, please complete that for us. We would like to collect at the end of the polling. Moving on to number 13.
Please rate your level of priority for the following policies and strategies to advance affordable, secure housing in Columbus. We're talking about rent-controlled units now. How essential are rent-controlled units to the survival of families in housing crisis in Columbus? Again, we want your response to affordable, secure housing. What about rate the level of priority for increased housing inspection and code enforcement activity? So think about your neighborhoods and think about some of the issues in our communities. How important is it for us to consider increased housing inspection and code enforcement activities? It's again working with some of our local elected officials. The next question around affordable, secure housing: what is your level of priority for support and assistance for new and existing neighborhood associations? We've all been a part of those neighborhood associations. Back in the day, it was block watches, and your grandmother was a part of it, and everybody in the neighborhood knew what you were doing, and they came together. They would have meetings and conversations and advocate for what was needed in the community. How essential is that to our neighborhoods right now? Let's move on to engaging at-risk youth and young adults. Again, please rank your level of priority for the following outlets to engage youth in Columbus. And we want you to rank again from 1 being the highest to 5 being the lowest. So think about mental health engagement for young people. We talked about toxic stress and how many of our young people are limited in terms of the level of support they receive to cope with crisis and traumatic situations in their lives. So how essential is mental health treatment and services for our young people? What about the next question, number 17, tutoring? What's your level of priority for tutoring, engaging young people in tutoring services in our community? Again, rank from 1 being the highest to 5 being the lowest. We just talked about it's not enough just to educate them. We have to make sure that we're digging a little deeper and giving our young people all the tools and the skills they need at an early age to be successful. Number 18, engaging our young people. What about workforce development? You heard earlier that transitional age youth, ages 16 to 24, is the highest growing population in poverty right now. There's been threats to cut WHEEL dollars, workforce development dollars, opportunities for our young people to thrive in the workforce. So how essential is it that our young people are coming out ready? How many of you employ young people, and sometimes you're feeling a little frustrated that they don't necessarily have the life skills, or they don't know how to complete an application, or literacy is an issue? So are we really putting our money where our mouth is? How essential is it for us to engage our young people in workforce development opportunities? Moving on to 19, engaging young people in health and wellness. With so many limited resources in our schools not providing that kind of essential learning for our young people, sometimes they just don't even know or know how to articulate for themselves when something is going on with their bodies, or something that they don't necessarily understand. This is a good one. Number 20, creative and artistic development. Creative and artistic development. I was just watching on Netflix the show called The Get Down. Anybody heard of it yet? And just watching those young people participating in hip hop and poetry and graffiti, art form. I mean, when you think about how we cultivate whether or not our young people can use the different sides of their brains and how they choose careers.
Some of our best favorite artists are singers and actresses, but we don't give our young people to have the same opportunity to just explore those as options for themselves. So how essential, again, is it for us to be able to provide that, not only in the community, but in the schools, and what are we doing to also lend our time and mentor them in these ways? And then lastly, engaging our young people in family and parental engagement. Rank from 1 being the highest to 5 being the lowest. Family and parental engagement. And you may want to think about this from all different perspectives. Some of our young people are young parents. And we have to think about all young parents, not just our mothers, but our young fathers too. Engaging the entire family. Their relationships with all of our families don't have necessarily a nucleus definition any longer. Many of our caregivers are, distant cousins or aunts or uncles or foster care families. But how are we engaging them as a unit and providing services for them? So how essential is that for us to consider when we move forward with this call to action? Thank you for participating in the text poll. If you've completed your poll form, again, pass it down the aisle, and one of the great Impact staff will collect it for you. It's been my pleasure to share the afternoon with you. I have enjoyed the dialogue, the conversations. Please join me in thanking our panelists one more time. I would like to bring up Mr. Chilton. Again, thank you for allowing me this moment. I think that Impact, of course, is, as we mentioned before, taking an audacious lead on making sure that the dialogue is not only taking place, but there's opportunities for us to be engaged and move the needle forward. So I hope I see some of you on the other side at the State House, at the City Council, in the community doing what we're supposed to be doing for our young people and our families. Thank you again for having me.
Thank you, Yvonne. I appreciate you taking this time to be with us and facilitate the dialogue. I want to thank all of you for coming out and participating in our poll and in this important discussion. We come to the end of this and now say, now what? Where do we go from here? There are several opportunities. One, you can become a mentor through Big Brothers Big Sisters. We talked about the level of engagement, and particularly with our young people feeling as though they do not have a caring adult who is concerned about their growth and their opportunities, and therefore we wonder why they're not listening to us in the same way and don't give the reverence that we once gave to our elders. So we got to get involved. Two, you can get involved with Impact Advocates. Senator Tavares talked about the work that we do with our advocates, and we've engaged them in civic engagement training. We've taken tours of State House and city and county and actually teach them how to speak in these committees and in the forums so that people can hear their voice and it shapes public policy. So you can get involved with us through Impact Advocates. You heard from Brother Aramis. And I imagine he said some things that made some people feel uncomfortable. And I appreciate, Dr. Gregor, what you said about your job is to make those 900 students uncomfortable so that they can be prepared and have the cultural competence to engage with people of diverse populations. And that's an important piece. One of the reasons why I believe that we have not had here in Columbus the same challenges that other major cities have had is because we do have people who have the courage to have the conversation. Oftentimes when people's voice is not heard and they feel like they have no other outlet, it bubbles up and takes on the form of negative expressions. Sometimes we have to have those conversations, and it's not always comfortable. Trust me, I've been in some community conversations where I and my organization have been challenged about how we're responding to the needs of the people. And it's not comfortable, but we're there listening and making sure that their voice is heard and that we're responding to that. And so we see ourselves oftentimes as a bridge builder. I want to challenge, my grassroots brothers and sisters when we're generalizing about a whole population of business leaders and public policy makers. I say not everyone sees things that way, and I want to push back on that. But at the same time, I want to speak truth to power and say that we need to hear the voices and we need to build those bridges. And so it's important that we're engaged in the People's Justice Project is one of those voices that is out there at the grassroots level, having those conversations, engaging our young people, and we need to hear what they're saying and we need to respond to that. And finally, I've become a recent member of the NAACP. I would encourage all to consider that. I know that we've had our challenges in the past with our local chapter. They are trying to rebrand themselves and reemerge, and so I think that that can be a leading organization and a way for you to all get involved. Finally, we will be compiling all of this information, putting it into a report, and issuing some call to action steps. And so we want you to get involved. We want you to have access to that information. So please, if you did not register, please do register with us. Finally, I'll leave you with a few final thoughts about why this was important for us to have this conversation. We do have a program called REACH where we're engaging the opportunity youth, out-of-school youth who are ages 16 to 24, and we want to know what else can we do to make sure that we're providing the best program that we can. We do have a successful reentry program. You heard Kisten talk about how 60 to 70% of the formerly incarcerated individuals are still unemployed a year after being released. We have a 90% success rate with placement 3 months out with all of our formerly incarcerated individuals, and we do that because we're providing them with the tools that they need to be successful. And so that was important to us. And then a new venture for us is going to be the affordable housing. We have over a dearth of 54,000 affordable housing units that are needed here in Columbus, Ohio. And we want to make sure that we're doing our part. And the reason why this was important to us is because in our reentry program, we had individuals who came straight out of the prisons into the homeless shelters. We were able to help them find employment, and they could afford to pay rent, but could not find landlords who would rent to them. Here they are, they have the income, they have the means, but because of their felony background, could not find affordable housing and a landlord who would rent to them. So that spurred our interest in working in this area. We recently held a focus group with 13 African-American women with children, and we asked them what are the things that are top of mind when you consider your housing options. Now I want to juxtapose that to, I posed that same question to some of my upper middle class friends about what are the top 5 factors that they consider when they're considering housing options. Many of them listed in that top 5, good schools for my children, housing amenities, is there a 3-car garage or a finished basement? So it became more about the amenities of the house. For our focus group, the #1 answer for all of them was safety. And it just told me the difference in mindset and what you're looking for. They said, I don't want to go somewhere where my children can't play outside. They have to be worried about bullets flying in the neighborhood. And #2 on that list was schools. So they want the best for their children, the same that we all do. What was also in their top 5 and threw me for a little bit of a loop, because all of these women had transportation. They had a car, but they said, is it near a bus line? They said, because cars break down. And so that let me know too, a middle class, upper middle class mindset is, hey, it's an inconvenience, my car broke down, I'll go get it fixed. But for these women, they say, if my car breaks down, I still gotta be able to get to work. I gotta be able to, get groceries and feed my family. So those are the types of things and the difference in mindset. And so I thought that was important. And then finally, in terms of being uncomfortable, I want us to get comfortable with the idea of being uncomfortable. And having these conversations, because when we avoid the conversation, it leads to misunderstanding and misconceptions about the other. But when we address that and ask, well, why do you believe what you believe, or why do you think this? And we have those conversations, when we're willing to confront that, then we begin to have true understanding, and we start to realize that we have more in common than we do differences. And I think it's important, and at times we're going to be challenged. I recall a young lady who sat outside of our building one time protesting that no one, she had signs on the corner outside my building saying that no one will help me, that she's been to all of these social service agencies and no one would help her. And so my staff told me that we had a protester outside, and so I said, well, invite her in, I want to talk to her and understand what's going on. And she walked in, and when she found out who I was, she got a little nervous. And I said, you know, have a seat, I want to hear what's going on. I said, why are your needs not being met? Why do you feel like we haven't addressed it? And she scratched her head, and I could see her wig move. And I say that, it sounds funny, but when I heard her story, then I said, wow. Her wig moved because she had cancer. And she was wearing the wig to cover that up. And she said, you know, Ms. Chill, I'm not trying to create problems for you. She said, but I've been to one social service after the other. She said, you know, I have a college degree. I've worked all my life. And she said, and I had this, I got cancer, and now I can't work. And she said, and no one will help me. She said, you know, I feel like I've done all of the things that I was supposed to, and no one is listening. And she said, you know, and I came to your organization and your staff said because I don't have a job that they can't help me with my rent. And I said, well, you know, I don't want you to be upset with my staff. I said, because based on the rules and regulations of the government funding that we receive, those are the guidelines. I said, however, I said, I am fortunate enough to have some discretion and we have some other funding. I was like, I want to support you. And so even if there have been times where we haven't been able to always help every single person, the fact that we're sitting down and listening and that they know, Dr. Gregoire, you said something very important, that I see you and that you matter, that you're not invisible to me, and that I'm willing to listen and to work together. That's what's most important. There is a documentary that I wish that all of you to see. It's called Poverty, Inc. And the biggest thing that they talk about is that we cannot come down as some patriarchal savior and say, here, we're going to provide the solution for you. And we want to feel good about ourselves for providing this and giving you this assistance and allowing you to be grateful. No, what we need to do is be in partnership with people, to understand what the needs are and to build plans to help lift people out of poverty. But it means something different when we are in partnership with people. And that's what we're about. Senator Tavares said it best when she said, nothing about us without us. And so that's where it needs to start. And so it starts with all of us working together, being in partnership with people. We have scarce resource, but if we leverage our collective resources, then we can create the ripple effect. Then we will make an impact. Thank you all for being here. I appreciate you. I want to say one other thing. If you have an opportunity, please grab one of the worksheets back here. A flyer. We have a public hearing coming up for our weatherization program. We've gone through a competitive bidding process. I believe we'll be successful, but we want to make sure that we have people there who support us and support the work that we do through our weatherization. So if you have that and you're able to make it out, we'd enjoy having you there. Thank you everyone for coming out. Thank you to our panelists for being here. Please give them a round of applause. I want to once again thank CTV for broadcasting this, Yvonne Freeman for being our moderator, Delightful Delights who catered that great event. Please take one of their flyers. And finally, thank you to all of our elected officials and public policymakers who made it out here. It's important that you see them and know them because these are the people that are engaged throughout the year, not just at election time. Thank you again for coming out.